What are omega-3s?
Yeah, so omega-3s have been studied for a very long time. They are not new to the healthcare system. They're not a fad whatsoever. There's plenty of data behind them showing that they've been linked to improving several conditions. Most commonly, we're talking about improvements in lipid levels. So for those of you that aren't aware, I'll dig into that a little bit.
Aren't fats bad for you?
The body has three types of lipids that we are worried about. And when I say lipids, that term is essentially synonymous with cholesterol. If you're worried about, your good cholesterol, your bad cholesterol, or your good lipids and your bad lipids, it's essentially the same thing. Good cholesterol is high density lipoproteins, or HDLs. Bad cholesterol is low or very low density lipoproteins, or LDLs/VLDLs. Omega-3s are actually meant to improve lab parameters on a specific type of low-density lipoproteins called triglycerides. Omega-3 oils, or they're often called fish oils, are a type of unsaturated fatty acids. When we think of saturated fats versus unsaturated fats, we're thinking solid animal fats, like the kind of fat you see on a steak or in hamburger, versus plant-based fats like oils, olive oil, avocado oil, those kind of things. Generally, the unsaturated fats are what has been known to have beneficial health outcomes. Now, within unsaturated fatty acids, you have a group of unsaturated acids that are the omega-3s and the omega-6s, while the saturated ones are associated with poor health outcomes. Omega-3 acids are acids like DHA and EPA. I won't go into pronouncing those names because they're very long and frankly no one really cares about them. The omega-6 fatty acids, you have acids like linoleic acid and arachidonic acid, LA and AA. Now, these HDLs and LDLs are not exactly the fats themselves, they're proteins, but they are the proteins that carry the fat molecules through your blood. Therefore, when we directly measure your protein levels, your LDL and HDL, we can correlate that with the amount of fats and lipids in your blood. Now, VLDLs, those very low-density lipoproteins, mainly carry triglycerides. Triglycerides are the main form of fat molecule that is found in your body. So when your body needs to store energy as fat, it stores on triglycerides. When it needs to release energy from your fat stores, triglycerides are released into the bloodstream. So of course, triglycerides are very important to overall health because they have an essential function in the human body. But having high chronic levels of blood triglycerides is linked to many things, including inflammatory disorders, coronary heart disease, possibly major heart events, all sorts of bad health outcomes. Now, our unsaturated fatty acids, like omega-3s and omega-6s, have been linked to lowering blood levels of triglycerides. When your body has an excess of energy that is not needed at the present moment, the liver converts that excess energy, or excess glucose, into fat molecules. This process is known as lipogenesis. In short, the liver makes triglycerides. And then those triglycerides get picked up by VLDL particles, travel through the bloodstream, and get stored in your fat. The liver synthesizes triglycerides. Those triglycerides are then picked up by VLDL proteins, carried through the blood plasma, and deposited in adipocytes, or your fat cells. It's thought that omega-3 oils oxidize fatty acids which are found in the liver. This means that those fatty acids are no longer suitable for storage in adipocytes. Thus, VLDL particles are not even synthesized in the first place, and VLDL in the blood is lowered. However, they are more effective on a different subset of your lipids than omega-3s are. We see the most efficaciousness of statins in relation to your LDL particles. That LDL cholesterol reduction is the main target when we think about dosing statins. So it is possible that you could be on a statin, have a great reduction in your LDL, and still have residual cardiovascular risk because your VLDL particles are still extremely elevated. When I talk about elevated, we're talking about a triglyceride level of maybe over 200, and over 500 is extraordinarily high. So in some patients, it's necessary to take a statin as well as an omega-3 supplement. In some patients, maybe an omega-3 is all they need.
What uses are there in literature for omega-3s?
The omega-3s have the most evidence behind them when it comes to lowering this cardiovascular risk caused by increased triglycerides. but they also have a little bit of evidence in other areas as well. Omega-3s are thought to be anti-inflammatories, so helping to reduce reactive oxygen species and reduce inflammation in the body, which is why they've been trialed in patients with arthritis and shown some benefit. Omega-3s are also thought that they might be protective against fatty liver disease, which makes sense if you think about it. If the presumed mechanism of action of omega-3s is to interrupt the synthesis of fatty particles within the liver, it would make sense that this could also be protective against fatty liver disease.
What are the components of a good omega-3 supplement?
Sure. So when we recommend an omega-3 supplement, there are prescription options available as well as over-the-counter options. Now, of course, benefits with prescription products include that they are regulated and you know exactly what you're getting, and they've been clinically trialed so that you know that the pill you're taking is for sure going to do what it says it's going to do. The downside can be that these omega-3 supplements are extraordinarily cheap to manufacture. It's fish oils. And they can be very pricey to get through the pharmacy, depending on copays and insurance. I can see patients paying a lot more than what I think is fair to access prescription omega-3 supplements. So then, of course, you have your OTC products, which, you know, as a reminder, OTC products are not regulated as strictly by the FDA. So there is no requirement to go through clinical testing, and there are a lot of less than quality supplements on the shelves. So whenever you buy an OTC supplement, you run that risk of purchasing an inadequate product.
Where does that omega-3 fishy taste come from?
Another potential problem with your omega-3 supplements on the shelves is that they can go bad quite quickly. I was not taught this in pharmacy school, but in reality, if your omega-3 pill is giving you that extraordinarily fishy aftertaste or those fishy burps, this is a sign that the liquid within the pill has oxidized and the supplement has gone bad. True, fresh omega-3 supplements should not give you an extraordinarily strong, fishy aftertaste. So if this is something that you're experiencing with your supplements, be sure to check the expiration date and try and evaluate if the supplement has been overly exposed to heat, light, or air, because those can speed up the process. Especially if patients are keeping their supplements on the bathroom counter. Prime example of a space where heat, light, and humidity would be really prevalent and could speed up the spoiling process of the supplement. When you're choosing an over-the-counter omega-3 supplement, there's a couple things that you need to look for. The first thing is that a proper dose, which has been studied in most trials done on omega-3 supplements, is anywhere up to about 3 grams a day. When we talk about dosing for fish oil, there's a couple things to consider. Doses of between 2 grams and 6 grams per day are generally considered effective and safe. Now, doses higher than 3 grams a day have not been studied as rigorously for long periods of time as those doses under 3 grams. So don't just take 6 grams because you think it'll be the most effective. You know, you have to individualize the dosing based on your patient's response. The DHA and EPA are 2 different chemical molecules. They are both omega-3 fish oils, and they are both required to have a robust, effective intake of omega-3s. The ratio of DHA to EPA within the supplement, that's up for debate a little bit. In the study, they found that the greater the ratio of EPA to DHA, the more the reduction in CRP. CRP, which is C-reactive protein, is one of the most common lab markers we use to indicate systematic inflammation. So you can abstract from this that maybe those higher ratios of EPA are more effective for inflammation control. However, it also looks like they found that with those greater ratios of EPA, there was a greater increase in systolic blood pressure in those patients. So there is no clinically defined perfect ratio for DHA and EPA. Most of the time when I look at supplements and I see a dose, it's usually just over 50% of that dose coming from EPA and around 40% coming from DHA, somewhere like that. So in summary, for your omega-3, you want to get somewhere around maybe 2 to 3 grams a day, depending on the response that your lipid levels have. And you want roughly a 50-50 ratio of EPA and DHA, with maybe a little more weight on the EPA. There have been companies that have experimented with, the delivery systems of these fish oils and patented compounds which change the adequate daily dose that patients should be taking. This product that is from Woven uses one of those patented formulations. The specific formulation that I'm referring to is Maximil. So when fatty substances are digested, they are absorbed in the intestines, and bile acids, which are secreted by the pancreas, are used to emulsify those fatty substances and absorb. Emulsification means to break down into bite-sized pieces, for lack of a better term. If a patient is taking a large dose of omega-3 fats all at once, there may be a point where in the intestine, some of that fat just passes on through because there is not enough lipase or bile acids available to absorb that amount of fats in a short period of time. This patented Maximil formulation is a formulation of omega-3s that has already been enzymatically broken down. That means when you take a large dose all at once, some of the work has already been done for your intestines, and you can get a much higher percentage absorption from that supplement than you can from other run-of-the-mill omega-3s. And now I think that's why, specifically in this Omega Flow supplement from Woven, the dose, the daily dose, is much lower than I would see for a traditional omega-3 supplement. It looks like they're specifically recommending 1 capsule a day, which is providing a total of 650 milligrams of omega-3 oils. Now, when we're talking about our traditional dosing, which is somewhere up around 2-3 grams, that doesn't seem like a lot. Now, this Maximil patented formulation on the company's website, you can see that they say that their product has been clinically trialed and shown to increase the absorption of those omega-3s by 300%, or 3 times greater absorption than you would get with a run-of-the-mill product. Now, personally, I haven't seen those studies, so I cannot speak to the validity of the science within them, but if you're taking their word for their branded product, then this supplement, this Omega Flow supplement, should be 3 times as potent as a generic omega-3 supplement from another company. So if you take 650 times 3, you're right up at around 2 grams. So that would be an equivalent daily dose to another supplement, which would give you 2 grams. I think a benefit for patients when taking a supplement like this could be that it seems like the capsules are much smaller than you generally see for an omega-3. I know that those omega-3 supplements can be very large pills, and you're having to take 2 or maybe 3 a day. That can be burdensome for patients, especially if they're struggling with dysphagia or having issues swallowing. So a smaller capsule size like this Omega Flow from Woven could be extraordinarily helpful in those situations. I also enjoy, as a healthcare provider, that this supplement is gluten-free and soy-free, so it's safe for my soy allergy patients and my celiac patients. And now, of course, when my providers are recommending this to their patients, I would want them to start with the recommended daily dosing of the 1 capsule a day, but of course that can be increased as response in triglycerides warrants. For my patients that are choosing to take an omega-3 of their own direction without direction from a provider, I just would ask that they inform their provider or their pharmacist and their doctor, because these omega-3s have been casually associated with increase in bleed risks. So for patients, especially that are on anticoagulants, Eliquis, warfarin, anything like that, it has also been loosely studied that omega-3s may have beneficial effects when it comes to neurodegenerative diseases. The diseases like MS, potentially Parkinson's or Alzheimer's. And the link there is that omega-3s, we know, help reduce inflammation, reactive oxygen species, mitochondrial distress. It's all kind of in that same ecosystem. So diseases that we think are linked to that autoimmune kind of inflammation, the body attacking the body, may be ameliorated by use of these supplements. Now, I need to quantify that there is the robust data to truly support that. It's not there yet. But in a patient who qualifies to take an omega-3 supplement because of their lipid levels, it wouldn't be totally out of the ballpark to say that there may be some inflammatory protectiveness and potential benefit in long-term cognitive diseases. I would want their providers to be especially informed that they decided to start taking an omega-3.